Stroke is a global problem. Annually, about 15 million persons suffer from stroke. Out of this number, 5 million die, while another 5 million are left with permanent level of disabilities. These disabilities may include paralysis of one part of the body. They were not able to take care of themselves and have lost the abilities to do the basic activities of daily living, which may include inability to go to toilet by themselves, inability to dress themselves, inability to take baths by themselves, inability to feed themselves. They totally and completely depend on caregivers. This is a big burden, financially, psychologically, physically, and otherwise, to both to them and also to the caregivers. And after all this, eventually, most of them also die from this disease, increasing the number of the 5 million to another higher number. In fact, it has been estimated that total number of deaths globally every year, stroke causes about 10% of them. This is a disease that has a high burden and can also be prevented. It gives signs months to weeks before the disease strikes the individual. And some of these signs are subtle signs that may not be recognized, or there may be signs that may be ignored by the people that have this stroke at the end of the day. I'm going to give you 5 tips, 5 of those signs, so 5 of those things to watch out, so that if it is noticed in anyone, you have to take care and go on more investigation and see a doctor and know whether you are going to be a victim of stroke in the nearest future. But before I continue, I would like you to subscribe to this channel and also press the bell notification so that any time we release a new video, you will be the first to get it. The first tip there is vision problem. The individual may have sudden loss of vision in one eye. This may just come suddenly, and within a few seconds, it will just disappear. The individual also may have blurring of vision, not able to see very clearly. In one way or the other, they are not able to see things that they have been seeing before. They may be seeing double. Apart from the visual problem, the tip number 2 is the speech problem. There is slurring of speech. There may be uncoordinated speech by the person. There may be inability to make complete and reasonable sentence. There may be inability for the person to continue talking, or the person may lose interest in talking. Sometimes it is also shows as the way that the person may not be interested to talk, but at the end of the day, it is a subtle sign of stroke. The third tip may be fatigue, unnecessary tiredness, unnecessary weakness without a reasonable cause. Unnecessary weakness of any part of the body may be a tip that the person may be having stroke in the nearest future. Tip number 4 is nausea and vomiting. You feel nauseated, you feel like vomiting, you may or may not vomit. This may be due to an impending stroke, that if nothing is done about it, the person is likely going to come down with stroke. Tip number 5 is that there may not be any sign. The only sign the person may have is the sign of a disease that has been diagnosed in the past, such as hypertension, diabetes, that are not controlled, and the rest of them. In my next video, I'm going to give you tips on how to prevent this stroke. I will also talk about the cause of this stroke and how to prevent it. Thank you for watching. Please remember to hit the bell icon and also subscribe to this channel. Thank you very much.